Each Eligard carton contains 1 dose of Eligard. Inside the carton are 2 sterile trays that contain the materials needed to mix and prepare 1 dose of Eligard. One tray contains the polymeric gel system, and the other contains the leuprolide acetate. Once Eligard is at room temperature, you are ready to prepare the product for injection. Remove the short blue plunger rod and attached gray stopper by pulling straight out. Insert the long white plunger rod found in tray A and twist it into the remaining gray stopper in syringe B. Remove the gray rubber cap from syringe B. Unscrew the clear cap from syringe A. Discard both caps. Join the 2 syringes by pushing them together horizontally and twisting until they are securely connected. Do not over-tighten. Eligard consists of the active drug leuprolide acetate suspended in a novel polymeric gel delivery system. This innovative biodegradable polymeric gel is in a biocompatible carrier that is thoroughly mixed with leuprolide acetate during the preparation of Eligard. A homogeneous mixture creates an in situ solid that enables a controlled, consistent release of the drug over the dosing period. Thoroughly mix by pushing the contents of syringe A into syringe B and pushing the 2 plungers back and forth for approximately 45 seconds. Once mixing is complete, hold the syringes vertically with syringe B, the short wide syringe, on the bottom. Syringe B is designed for the subcutaneous injection of the reconstituted Eligard. Push the contents of syringe A into syringe B by depressing the plunger of syringe A while slightly pulling down on the syringe B plunger. Detach syringe A while pulling down on the syringe B plunger, and then attach the safety needle to syringe B. Small air bubbles will remain in the formulation. This is acceptable, and they do not require removal. Once prepared, the Eligard mixture remains stable for 30 minutes. If not administered within 30 minutes, the product must be discarded. Eligard can be administered in any area with adequate subcutaneous tissue. The short safety needle is specifically designed to deliver the reconstituted Eligard into the subcutaneous layer. The short safety needle is quickly inserted at a 90-degree angle. Eligard is injected as a gel into the subcutaneous tissue, creating a small pool, and will form an in situ biodegradable solid upon interaction with the aqueous fluid. An exchange of the biocompatible carrier within the mixed Eligard and aqueous fluids in the subcutaneous tissue causes the polymeric gel to rapidly solidify, creating a biodegradable solid that delivers a controlled, extended release of leuprolide acetate over the entire dosing period. The leuprolide acetate travels through the circulatory system until it reaches the pituitary gland in the brain. Eligard's mechanism of action inhibits the release of luteinizing hormone, normally produced by gonadotropic cells in the anterior pituitary gland. Luteinizing hormone normally acts on Leydig cells in the testes to produce testosterone. Hence, Eligard lowers levels of testosterone in the body. Eligard, with its novel polymeric gel system, provides consistent and controlled extended release of leuprolide acetate throughout the entire dosing period to effectively suppress the hypothalamic pituitary gonadal axis. Across all 4 doses, Eligard achieves low testosterone levels and maintains castrate testosterone levels across all 4 dosing intervals. In the 4 studies, Eligard decreased serum PSA in all patients whose baseline values were above normal. Eligard has a well-tolerated safety profile. Eligard is indicated for the palliative treatment of advanced prostate cancer. Eligard is contraindicated in patients with hypersensitivity to GnRH, GnRH agonist analogs, or any of the components of Eligard. Anaphylactic reactions to synthetic GnRH or GnRH agonist analogs have been reported in the literature. Transient increase in serum levels of testosterone during treatment may result in worsening of symptoms or onset of new signs and symptoms during the first few weeks of treatment. including bone pain, neuropathy, hematuria, bladder outlet obstruction, urethral obstruction, or spinal cord compression. Hyperglycemia and an increased risk of developing diabetes have been reported in men receiving GnRH analogs. Monitor blood glucose level and manage according to current clinical practice. Increased risk of myocardial infarction, sudden cardiac death, and stroke has also been reported with use of GnRH analogs in men. Monitor for cardiovascular disease and manage according to current clinical practice. Androgen deprivation therapy may prolong the QT/QTC interval. Consider risks and benefits. May cause fetal harm. Convulsions have been observed in patients taking leuprolide acetate with or without a history of predisposing factors. Manage convulsions according to the current clinical practice. Eligard may impair fertility in males of reproductive potential. The most common injection site adverse events are transient burning and stinging, pain, bruising, and erythema. The most common systemic adverse events include mild to severe hot flashes, sweats, malaise and fatigue, weakness, myalgia, dizziness, clamminess, testicular atrophy, and gynecomastia. As with other GnRH agonists, other adverse reactions, including decreased bone density and rare cases of pituitary apoplexy, have been reported. See package insert for full prescribing and safety